8 months after open heart bypass surgery. This is how I'm doing. Hey, what's shaking bacon? My name's Bruno Panucci. I hope you're doing well. So, as lots of you know out there who are watching this video, I haven't done a video other than my last video for quite a few months. Well, my health wasn't the best after my open heart surgery, so I've had some good things happen and I've had some bad things happen. And I don't want this video to be really a negative video, but I plan on just telling you all the good and bad that I've been going through since my surgery. So I want you to not be discouraged by any of the bad things because everyone's experience is going to be different. Now, I went through a couple mistakes that they made at the hospital, and I was dealing with the aftermath of that. I'm also doing some things on my own that they're not too impressed about, and I've had to deal with that. And I've also had a health complication since the surgery. It's not uncommon, but I believe I've been dealing with pleurisy, but I'll get into that. I'm going to try and do everything in order. So for any of you that are new to this channel, I turned to carnivore after a major heart attack at 42 years old. I had yo-yoed with my diet up and down for many, many years. My weight was all over the map. I got as high as 465 pounds. I'm now floating around 310. Sometimes I'm 8 pounds lower. Sometimes I'm about 5 pounds higher. But I fluctuate in that window. Honestly, a lot of it depends on if I'm having cheese in my diet. After my open heart surgery, I got as low as 301 pounds, and it's like a block my body has. It's just not going below 300 pounds. But fortunately, I think I have a possible solution for that, which I'll get into later in the video regarding my thyroid. So I went for an angiogram about a year and a half ago to see how my stent was doing after I had my heart attack. They told me when I had my heart attack, my myocardial infarction, that it was 8 to 10 years you'd get out of your stents. Some people get way more. Some people get way less. 8 to 10 years was the average. So I started pushing for an angiogram because I wanted to see how my stent was filling in. It took a long time before I could get that because the doctors just refused to give it to me. Finally found a cardiologist who was open-minded to it because my stress test was so bad, I had to go get one. And I basically fell between the cracks. He forgot to call me back after I had my stress test. And in Canada, in Ontario, the way it works is no news is good news. If they don't call you back, everything's fine. So 6 months afterwards, I got a phone call and the doctor said, "Oh my God, you got to go for an angiogram." And I was like, "What?" They're like, "Oh yeah, like this is serious." And that's the long story short. I explained it more in another video. So I went and sure enough, I had a major blockage in my stent and I felt fine. I was riding my bicycle to work and back every day, almost every day, for a month before I had this angiogram, and I was making progress. I was going up 3 hills on the way back to work after work each day. And the first day, I had to walk up all 3 hills pushing my bike, and I had to stop between hill 2 and 3 because I had to just catch my breath. And I was probably there for like a good 5 minutes at least before I tried walking up the 3rd hill. And by the end of the month, I was making it up the first 2 hills on my bike, no problem. And the 3rd hill, I was maybe 2 or 3 weeks away from being able to execute completely all 3 hills. And I was like, this is awesome. So I was more surprised than anyone to find out that my blockage was as severe as it was in my right coronary artery. Now, I had a complication in the hospital. I explained this in more detail in one of my other videos. They were messing around with my blood pressure. I went into the surgery telling my surgeon, I don't want to be on blood pressure medications because I don't have high blood pressure. Being on carnivore got rid of my high heart rate, my high blood pressure, balanced my blood sugars, my A1C. I lost a lot of weight, 165 pounds. That's pretty cool. And I was doing really well, except for my fasting insulin is still really high. I can't account for that. I've talked to endocrinologists and they just go, well, it is what it is. Here's some Ozempic. And that's not a solution. I'm not up for that. I'm not 100% against it. If you like Ozempic, all the more power to you. But I want to find out what's causing my high blood sugar. So the doctor said, I'm only going to put you on blood pressure meds for the first 3 months because they do other things as well as affect your blood pressure. So it's kind of killing 2 birds with 1 stone. We want your blood pressure to be really, really low for the first few months while everything's healing. So we don't want those new seams under pressure and demand. So I thought, okay, it makes sense, logical. So I was fine with that. And in the hospital, after my surgery, I had a broken rib. I thought maybe it was a dislocated rib, but I definitely had a broken rib on my right because that's not uncommon when you go for an open heart surgery. If this was your spine down here and this was your sternum up here and these are your ribs, they have to open everything up. So all these joints down here are going to be affected. I hope the sound quality was okay when I just did that. But anyway, when they put everything back together, those joints are messed up and they could break some ribs in the process. I definitely had a broken rib, and I didn't feel it till about a day after I was out of ICU. Actually, it was that night after I got out. Probably within an hour or two, I started feeling this intense pain. I would say it was below my nipple out to the right on my right-hand side. And it was just really, really uncomfortable. Hurt to breathe deep. And they kept telling me, look, you got to breathe deep. It's important you breathe deep after this surgery because you don't want to get pneumonia while you're in the hospital. So make sure you breathe deep. Well, I couldn't really breathe deep with this broken rib. Now, day after day, that pain got better. That being said, I didn't feel any pain. I didn't feel any pain. And I know I probably wouldn't feel any pain because I've had family members who have gone for open heart surgery, my father, and he wasn't in pain when he was in the hospital. He was really pain-free. But when he got home, he was in a lot of pain for the first couple weeks. He doesn't remember it that way, but everyone else does. He was in a lot of pain. And I was expecting that as well because you're off the liquid morphine and now you're just on the pill version and it's not quite as potent or strong. So when I got home, I still didn't have any pain in my sternum, in my arm where they went for an artery. They took my radial artery out. They also took an artery out of my chest, and they also took a large vein out of my leg. Keep the comments clean. And they took it down from my groin all the way down past my knee. So we're talking at least 1.5 foot long scar. Those were fine. I found out I was allergic to the clear medical tape in the hospital. My skin would blister, so I had to start using paper tape. So now I was healing from the scars and the blisters, which were superficial, but it still complicated things a little bit when they had to put tape on my leg. Now, I did all my walking around. Everything was good, but they kept lowering my blood pressure day after day in the hospital to the point where it got to 77/57, dangerously low. And I said, I feel a little off today. And they said, okay, well, you know what? We're going to raise your blood pressure a little bit. We'll lessen your meds just a notch and we'll leave you there and we'll let you go home later today. So I thought, this is awesome. So I went to the bathroom. I'm like washing up. I'm doing all the spot washing because I haven't showered in a week. And I'm like, yeah, I'm going home today. You know, I'm washing my armpits and everything. And all of a sudden I noticed, you know, I feel weak. Not like I'm ready to pass out or anything like that, but something was off. I noticed it when I walked around the floor of the hospital that day, just getting my laps in. So almost like I was just tired. So I had low blood pressure years before when I was a teenager. So I know what that feels like. And this didn't feel like that. I just felt off. And so long story short, I passed out. They found me in the bathroom, passed out, chest down over the toilet with a broken sternum. And they got me to my bed eventually. I passed out about 12 times between waking up the first time to when they finally got me in the bed, and they had to make sure it wasn't my heart. So it took a few nurses to hold the ECG stickers onto my body because I was so sweaty after passing out. And so they had to literally hold them onto my body while they were checking my heart. Everything was fine. And I told them it was my blood pressure. They did a high contrast ultrasound on my heart to check out my blood flow afterwards. It was low, but good. It was 45% output. Normal's 55. I was always hovering around 65 even after my first heart attack. So I was pretty pissed because they were effing around with my blood pressure way too aggressively in the hospital. And I was the one that paid the consequences for it. So I threw my back out from that. So the sad part about that was everyone who saw me for like the next 2 weeks after I got home saw me moving like an old man and in pain. Every time I moved, I was like, oh, because my back was so bad. And everyone was looking at me with this pity, like, oh, you poor man, you just had open heart surgery and you're in all this pain. And it's like, it's not the surgery. I feel fine from the surgery. I was not in pain at all from the surgery anywhere. It was my back. My back got thrown out from the fall. And I hadn't had that back problem in like 10 or 15 years. So it was very frustrating that I had to deal with that. And I couldn't get a chiropractic adjustment for my back because it was my sacroiliac joint that went out. And anyone who has SI, sacroiliac joint pain, knows what I'm talking about. You need to get a chiropractic adjustment where they sort of twist your shoulders one way and your pelvis the other. And I couldn't do that because I had a broken sternum that was healing. So I happened to be a massage therapist, and I tried some stretches and exercises, and they worked beautifully. So within a very short amount of time, once I started implementing these exercises and stretches, it really helped take the pressure off my low back. And you know what? It was something new that I learned on the internet. So I was really thankful that an old dog can learn new tricks. I've been a massage therapist for 25 years, and the simple stretch and exercise of pushing my knees together and pushing them apart and pushing them together and pushing them apart isometrically made a drastic difference on my pelvis. So once that pain was gone, I just had to keep healing from the scars. Now, 4.5 weeks in, the chest scar I have opened like a zipper. And I guess the dissolvable stitches dissolved a little bit too soon, and a hole probably about this big was in the top of my chest right about here. And they got infected. So I had to get that washed out, cleaned out. They cut all the scar tissue away while I was in the hospital, awake in my bed as the doctor was just putting needles in my chest to locally give me a sedative. And then they cut all the tissue out. We talked about all sorts of different things while she was doing this procedure. I was surprised they did it right in the bed, not in a surgical ward. It's just a superficial wound at that point, but they got rid of all the infection, and I had this deep sort of hole in all the soft tissue in my chest. The bone healed nice. The muscles had done fine, but the soft tissue was taking longer to heal, probably because I'm a big guy. After that, they put a vacuum sealing on my chest to close the wound. And this is a big argument I had with them because they wanted to do that. And they said it could take months before that closes. And I was like, oh no, we're not doing that. And they're like, well, you need to, do what's right for your body. And I was like, yeah, we're not doing that. Just sew it closed. And they said, we can't sew it closed because we don't want to trap an infection in there. And I said, find out what kind of infection I may or may not have by taking some samples. And you can give me antibiotics specifically for that. You can start with some broad spectrum and then give me specific antibiotics, because here's the reason. I can't afford to take more time off work. I have a little bit of money left, and that's it. After that, I'm pooched and I'm going to be broke. And they're like, well, you have to decide what's more important, your health. And I said, or what? Being homeless? Come on, right? Like, that's not an option. I can't wait another 3 months on top of the 2 months I've already waited to go back to work. That's not an option. It is not an option. We need to do something different. So they did that vac dressing for a while. It's where they put like a piece of foam over the scab or the scar, and they put a sticker over your chest, which sucked every time they tore that off because I'm Italian and hair grows. So what happened was it would slowly close that with suction, right? Just like if you put a vacuum up to a plastic bag that you're taking the air out of it because you want to store some clothes. Same thing with the chest, and it slowly starts closing the scar. Now, after about 3 weeks, they concluded there was no infection, everything looked good, and they went in and they did the surgery to close everything up again. They wanted to put me under general anesthesia for that, and I went, nope. And they were like, well, this is a pretty common procedure, and I was like, nope. And I had a friend of mine who said, I'd hate to have you as a patient, because all he heard was me contradicting my doctors all the time. And I was like, look, what's the danger of surgery? Is it the surgery or is it the anesthesia when they put you under? Because there's layers to anesthesia, and the last layer is a stage before death. This is, by this point, a superficial scar, no different than you might have on your leg or your arm when they just suture you back up. That's all I needed. My chest had healed fine. Everything else was good. This was a superficial, it was a big joke because I was like, it's only a flesh wound, but I just needed this closed. So I said, just do it like you did when I was in the hospital bed. I said, look, just do it like you did when I was in the hospital bed. Put local anesthesia all through it and just sew it closed, please, because I don't want to be put under for such a minor surgery. It's a minor surgery. And I kind of had a fight up until the last minute to do it because the anesthesiologist was fine with it, but he had to sign off with this guy. And then that guy had to sign off with the next guy. And then it came to the surgeon and he said, well, it's best that we put you out. And I was like, no. He said, well, we can give you the equivalent of like an epidural that's going to block off everything across your chest so you don't feel anything. And I was like, it seems excessive. Just give me a local. I already went through it once. I don't mind if you do it again. I've had stitches before, so let's just do it this way. And so he was like, okay. And he was really good about it. It probably took about 45 minutes or so in the OR because they took everything out that was all that scar tissue that had been forming, which makes me wonder why they had to have that vac dressing. But either way, they took all that out and then they had fresh tissue to sew against fresh tissue, and they sew it underneath, and then they sew the skin. So they were really tugging. I could really feel them tugging as they were closing everything just like tightening your shoelaces really, really tight. They were reefing on the thread or whatever it is that they use for the stitching. So that was closed. Then they stapled it on top of that. And after about a week, they took those out. So I still had to let that heal before I could go back to work. I was off work a total of 3 months. I had a couple carnivore friends out there help me out. I really appreciate that. I came home from surgery and I had a package waiting on my back door. And it was from my carnivore friend, Tammy. And she gave me a big box with like puzzles, drawings, like wipes to wipe myself in case I was going to have a hard time, because I couldn't really shower for that while. So she gave me all these things, like this big, huge care package. Another friend of mine, she gave me some money. I really appreciate her doing that. Just helped me out, because at that end, I was down to dollars. I was down to, I think, $150 waiting for my first check to come in, because I wasn't working and I'm self-employed. And my rent is really expensive, not because I have extravagant taste. It's just the market in Canada is ridiculous. It's absolutely ridiculous. So I had financial burdens on top of going through this. So my goal was to get back to work as soon as possible. And it sucked that I had to wait as much as 3 months to go back. If that scar would have initially healed the way it should have, I'd have been back to work in about 6 to 7 weeks. No problem. I made sure I had all my food prep done before my surgery so I could just cook some burgers on the stovetop every day. I had everything prepared. I had lazy boy chairs I had brought in. I had done everything I could to prepare. Those were loaners from my siblings. I actually gave them to them a long time ago. So I said, hey, can I borrow these back? So I was getting by pretty well, managing on my own because I was alone. They had nurses come by because I was on my own, and they just wanted to check up on me every couple days or every few days. I wasn't able to exercise. Someone was criticizing me for the first little while because I wasn't going to the gym. And she kept saying, like, you need to be at the gym. And I was like, I can't go to the gym right now. She's like, you need to go. Even if you're doing something light, you need to go. And then after a few weeks, maybe 2 or 3 weeks, I was like, why are you harping on this? Like, I'm doing what I'm supposed to be doing. I'm going for walks. And if I walk too much, by the way, at that time, my left leg would balloon up from inflammation. And I said, why are you not letting this go? She said, because you need to be doing cardiac rehab after your surgery. And I said, not after open heart surgery. No, they don't want me doing exercising. They don't want me getting sweaty. They don't want me raising my heart rate up too much. Right now, after that surgery, they just want me walking. They want me walking up and down the street. They want me eventually walking around the block as a goal, just to show you how light they want your activity to be. And the reason why I couldn't go on a bike machine, as this person was insisting, or a treadmill or anything, was I had a huge scar down my leg. You don't exercise when you have a huge, deep scar down your leg. You can't. You just can't exercise. You shouldn't be exercising. You probably physically can exercise, but it's not really the best thing for you. But as soon as that was healed, after about the 4 or 5 week mark, I started doing a squat challenge, and I really enjoyed doing that. It was getting me active for the first time in a while. But I know from sitting around for 3 months, I didn't want to risk doing anything that was going to prolong this healing any longer, other than that squat challenge. And I tell you, I lost a lot of muscle. I lost a lot of lean mass in that 3 months of sitting around. My arms, I see it in my own arms, and I can feel it in my body. I'm just much softer. Now, I'm a big guy. I always had a lot of muscle and fat, but I noticed that muscle, I bet you I'm down at least 15 pounds of lean mass from sitting around for 3 months. So I didn't expect it to be that bad. So one thing I started having issues with after I went back to work, I was riding my bike back to work, was a pleurisy. I think it was pleurisy. It's either all those joints in my spine are out of whack and the muscles are stretched, or the ligaments are stretched and the muscles are out of whack from my spine. Like I said, doing this and then this after they closed it up again, all those joints on my spine, I think had a rough time readjusting. So either it's all those fine joints being out of whack, or it's pleurisy, but it feels like I get a rib and it happens all over my back. Happened in my first rib. I happened in the lower rib on my left side, then on my right side. The first time I thought it was kidney stones. The pain was that intense. And I don't know if it was that or pleurisy. They haven't given me a diagnosis yet. That's not uncommon after open heart surgery. So it was really bad. That's one of the main reasons why I didn't make a video, because my breathing was so extremely tough. I remember one night getting into bed, and this is after all my scars had healed. And I remember looking at my bed thinking, oh man, like 10 minutes I stood in front of my bed thinking, I don't want to lie down, because just the act of lying down and putting that pressure on my spine would make my breathing so labored, it would take me 10 minutes to catch my breath. I could walk up a flight of stairs and I was horribly out of breath. Whenever this got aggravated, I was out of breath easily all the time. So little things could easily put me out of breath. Standing up from a chair would put me out of breath for about a minute or two. Just little things, just exerting myself that littlest bit. So it was a challenge, and it's been coming and going for the last few months after my surgery. This all started in August, and now I'm recording this video in early January, 8 months after my surgery. And it still happens, but I can catch it. And one of the things that helps the most is aspirin, a lot of aspirin, and anti-inflammatories and muscle relaxants to keep the muscles relaxed while I'm dealing with the muscular spasms that go along with this. I feel like I just need a chiropractic adjustment when it happens on my first rib. I can feel it. I've found some ways to manage this. So before it gets bad, I've always said as a therapist, get your problems fixed before a 4 turns into a 7. Because it's easier to turn a 4 down to a 1 or 2 that's manageable than to bring a 7 down to a 1 or 2 and on a pain scale of 1 to 10, right? So anyway, that's what I've been going through since my surgery. Overall, that seems to be a thing of the past. I've honestly been leery about doing weight training because I feel like that's triggered this spinal problem that I've had, or the pleurisy, I'm not sure which it is, this inflammatory problem. So overall, that's the experience, good and bad. The good news is my thyroid has gotten more healthy in the last few months, and my medication has been too strong. So I had that readjusted, and I'm sleeping much better, because for the last 6 months, I've been waking up every half hour. Just open my eyes and close them. So I'm hoping things are going to start continually getting better that way. I'm able to be more active now. So everything's going back to normal, really. It's just a matter of cleaning up that financial mess from before. And I appreciate you tuning into this video. If you have any questions and you have anything you want to learn more about my experience from an open heart surgery, let me know in the comments, and I'll try and make a video of it if you think that might be helpful. All right, thanks a lot. Take care.